Welcome to Lipstick Attitude, hosted by Dr. Elizabeth King, psychotherapist, hypnotherapist, author, and motivational speaker, specializing in trauma and women's mental health, and Yvonne Haase, psychotherapist and coach specializing in relationships, couples, and women's issues. This show is your dose of inspiration, information, and laughter. In each episode, Dr. King and Yvonne bring you hacks, tips, and inspiring stories to help you live a successful life. So ladies, grab your lipstick. It's time to do this. The Lipstick Attitude podcast is powered by Suit Stilettos and Lipstick Foundation, a nonprofit movement to empower women and children from all walks of life to be resilient, self-confident, and purposeful leaders through education, mentorship, and community outreach. To learn more, visit sslwomen.org. Please note that this show is intended to empower and educate. It is not meant to be utilized as a substitute for individual therapy.
Well, good morning, everyone. This is Dr. Elizabeth King, and this is the Lipstick Attitude with my co-host, Yvonne Haase. Hi, Yvonne.
Hi, Dr. King. Hello, everybody. Welcome back.
Welcome back. It's been a while since it's just the two of us.
Feels
I know
weird. It's so weird, like not
Isn't
to
it?
have somebody to, pick
Harass? I mean, interview?
Yeah, same thing.
I'll say same thing.
Same thing.
For all our guests out there, we love you so much. And I know that there will be a lot more guests coming on, but today we wanted to do a special program because it is Mental Health Awareness Month. That's what May is all about. And of course, because Yvonne and we're both psychotherapists and so involved in getting people to understand mental health, we thought that this would be a great opportunity in the middle of the month to talk about mental health and mental health awareness. So I think this program is going to really speak to our hearts because this is what we do on a day-to-day basis. And honestly, even Suit Stilettos and Lipstick Foundation is really based on bringing mental health awareness, because empowerment and resiliency and being able to really face the world is all about mental health. It's what's going on in your brain really is really the key to it all. And when we talk about the lipstick attitude, it is about what is going on in your head.
Absolutely.
So every year, millions of Americans face the reality of living with mental illness. And, by the way, I want to be really clear that when we talk about mental health, it does not always mean mental illness. I think people use those two terms interchangeably. And Yvonne is even going to talk even about mental wellness. Those are all different topics. But mental health is exactly what it states. We talk about physical health and everybody gets that. Everybody knows when you talk about physical health, it means, you need to feel well, so you go for your regular checkups, you do things that keep you healthy, but we don't do the same thing for mental health for some reason. Mental health, I think, really has taken its toll on the way people think, because I think the stigma that's attached to it is so profound. And, listen, I'm Latin, and in my country, and I'm from the Dominican Republic, in my country, we don't even talk about, mental illness or mental wellness or anything like that. It's just not talked about. It's just recently that people are now talking about going to a therapist, but it's really awesome to see in the United States that more and more people are seeking therapy and are talking about it. Do you see that, Yvonne?
I totally see that, but I was going to add in that some of it, I think, has to do with celebrities coming forward and being more open about suffering from depression and anxiety and alcoholism and drug abuse and, all of these different things. And bipolar disorder, there have been so many coming forward and saying, I have bipolar disorder. And they, I think, are allowing people to be more open and say, hey, maybe it is okay for me to talk to somebody because my favorite celebrity talks to somebody. So I think that has actually, in a way, media has helped us.
Yeah, that's so true. Social media as well. I am now, as you know, actively on Instagram, which is something that I never
Welcome
did
to the
before.
club.
Yeah, I'm trying, guys. I'm trying, but I'm following some people that are influencers that are outright saying I'm bipolar, I'm schizophrenic, because I'm learning how to use hashtags and all that. And the hashtag that I'm using mostly is mental health advocate. And so they're finding me and following me, and they're influencers. They have hundreds of thousands of followers because people want to hear about their journey and their process. And I am super excited for this time in our life where we are actually talking about it. But the purpose for Mental Health Awareness Month is to raise awareness, obviously, and educate people about mental illnesses, as well as the differences between mental health and mental illnesses, mental wellness, really educate people so that they are comfortable with that. 18% of Americans who suffer from depression and schizophrenia and bipolar and live in such torture in their minds, right? And they're trying to really learn strategies to obtain their mental health and wellness. And I think that more and more people, like you said, Yvonne, are talking about it. Stars are talking about it. Right now, I have like a group of women, young women in their 30s, that are telling their friends, hey, come and see my doctor. She is amazing. And I love it because they're all even, they joke about it because they talk about me around the cooler. I'm their cooler conversation. It's like, wait till Dr. King hears about this. And, because they have common journeys in their life, because they're in their 30s, going through, learning to love themselves, learning how to navigate this world as a woman, everything that goes on in life, right? So they talk about going to therapy, which is kind of cool.
I like it too. And I'm getting younger and younger patients who are making requests of their parents to come in for therapy. They want to start talking to someone. And especially, I think, during this pandemic situation, I think that has certainly caused an increase in our business, and people wanting to get a lot more support, just to feel better while they were sitting in quarantine for so long.
Yes, I think COVID, of course, has been horrific for all of us. It's been a very difficult 2 years or a year and a half, whatever we've been going through this. But there is a silver lining here in that there are people talking about this even more so, and are now actively looking for a therapist. I mean, I've never been as busy in my practice as I am right now, and I know you as well. We have waiting lists. We can't take any more people, but that just tells you the level of anxiety, number one, that people are going through. But on top of that, the level of comfortableness, if that's a word, I don't know if I just made that up, but
works for me.
It works for you. They're comfortable to be able to say, I need help, which is super good.
Yeah, no, absolutely. But I like that you started with, touching on the differences between mental health and mental illness, because it's still such a stigma, right? So people will still say things to me like, I didn't think that I needed therapy because I didn't think I was crazy. I'm like, well, you're still not crazy, right? So that's not why you're coming to see me. So mental health, when we're talking about mental health, you're actually talking about your mental well-being. Right? So these are your emotions, your thoughts, your feelings, how you solve problems, how you overcome things, how you deal with social situations and concerns. Basically, it's your understanding of the world, how you view the world, and the different thoughts and thought processes that you have. Mental illness, everybody has mental health. Not everybody has mental illness. So
thank you for saying that.
Yes.
That's a point that you need to underline, people. Mental health is what everybody has. Mental illness is not what everybody has.
Exactly. And not everybody will experience a mental illness in their life, right? So, but a mental illness is that it's an illness, and it will impact the way people think, the way they feel, the way they behave, the way they interact with others on a consistent basis, right? So, you know, somebody who feels sick doesn't necessarily have a serious illness. Somebody who's going through a depression because maybe they lost a loved one does not make them clinically depressed. So you can have, some poor mental health situations that are happening around you that create that for you. It does not mean that you are diagnosed with a mental illness. We all get anxious about some things. I mean, I experienced when the pandemic first happened, going to the grocery store and feeling anxious. It does not mean that you have generalized anxiety disorder.
Right.
So they're two different things. You can have one without the other, but it just like everybody has physical health that we need to maintain, absolutely everybody has mental health that we also need to maintain.
We did
have one without the other.
We did a show some time back called "It's Okay Not to Be Okay," and we would like to refer you. I want you to go back and listen to that show because you'll hear some of these same things, but there's some other very specific things that we talked about in that show that will be tied into this. And so go back and listen to "It's Okay Not to Be Okay." But as we talk about mental health, especially with COVID-19, I think the prevalence of mental illness among adults increased. For sure, we saw an increase of 19% of adults experiencing mental illness. And we're going to talk about kids in a little bit, but we're going to specifically address adults. Adults are suffering from depression, anxiety, panic attacks, and tremendously since the pandemic. And now, going back to work is another trigger because, and I'm sure you see this in your practice, Yvonne, more and more people are now feeling that anxiety of integrating into society after being isolated for so long. And now we're hearing, okay, we're going to take the mask. I know that I'm hearing people freaking out about taking the mask. I'm even concerned because I think, well, will we know if somebody is vaccinated or no vaccinated? So all those thoughts that are going through your head creates stress, doesn't create necessarily mental illness, but it certainly creates a level of stress that could be debilitating and could turn into a mental illness where you may become clinically depressed if you don't take care of it. So we saw an increase when the pandemic happened because of isolation. And every time I spoke, I talked about social distancing does not mean social isolation. And I was very specific to talk about that because I saw the writing on the wall. I saw that a year down the road, we were going to be facing what we're facing. And maybe, hopefully, by talking about it during that time, maybe it did help all of us, all of the people in the mental health world. We were all talking about make sure that you're seeking help, that you're looking for ways to connect. I mean, that was a broken record, I think, from all of us. And hopefully we made a difference. But we know that right now, people that are now looking to go back to work or just get back into going out to a restaurant are feeling super anxious. So we're going to monitor that carefully and really give out as much information to folks so that you know that you're not alone and that it's important that you stay connected.
Well, I think too, the suicide prevention hotlines were very, very busy during the pandemic. And we heard stories of doctors and nurses who committed suicide during the pandemic from everything that was going on. But more people now are reporting frequent thoughts of suicide and self-harm than ever before reported. And it's estimated that we have about 178,000 people who report frequent suicide ideation. So not even, just a one-time kind of thought when they got overwhelmed, but that we're actually having more frequent thoughts of suicide, dealing with everything.
I go back to the fact that people are struggling with being lonely and just being isolated. And for the youth, that was a huge thing too, right? So mental health in youth also was I should say mental illness in youth also worsened during this time, and more suicide ideation and more suicide attempts in the youth. And, we're right now putting together a program through Suit Stilettos and Lipstick Foundation called RISE, a resiliency and leadership program, which is really geared for mental illness and mental well-being for kids 11 through 17. And we talk about all of the reasons why kids want to commit suicide and what we can do to prevent it, creating that resiliency characteristic that we know that will help them to overcome struggles in life. But it's just been a really tough 1.5 years. Really, the bottom line is that it's just been tough for everybody to get through it. We've gotten through it together. Unfortunately, we've lost so many hundreds of thousands of lives in the US and across the world. And it's just, it's just been a really tough time. So as we are, recovering from such a horrific stage of our existence, we're going to have to work, day and night to really keep our spirits up and our mental health up to date, because if not, it's going to be more detrimental than not. So we really need to talk about it. And that's why it's perfect that May gives us this opportunity that we can talk about it, and people are willing and able to listen.
I wanted to touch base about the kids going back to school too.
Yeah. Oh, yeah.
Increasing anxiety, because I work with a lot of teenagers, and they, at the beginning, were kind of like, oh, well, this is exciting. I get to do school from my bed. By the time the second school year, the next school year rolled around, about midway through, they're anxious to get back, and they want that interaction, and they're missing their friends. And it's, it's not the same for them on video as it is in person. But then, now I'm speaking for kids in Florida, because that's where, we reside, but they do the FSA testing. And so a lot of my kids were going back to take their FSA test, and they came back with anxiety. They're like, I don't know now if I'm really ready, because that was only a portion of the kids coming back. And now, obviously in the fall, everybody's going to come back, and they're having a lot of anxiety about it.
I can imagine, I know quite a few teachers that the teachers are having anxiety, and and they tell me, they report that their own kids are having anxiety, and these are the teachers' kids. So I can't even imagine what other kids are going through. It is a very, very difficult time, and I really would recommend, and we're going to talk about tips on how you can help yourself through this going back into the world phase that we're all going into. But for kids especially, we really need to help them deal with stress. And, that's really my number one tip, is for all of us. We all need to deal with stress, but we definitely need to teach our kids on how to deal with stress, how to, journal their feelings. They could, take walks with their parents, talk about it with their kids. Yvonne, you have 2 teenagers. Do you talk about them going back, integrating into school right now? What are you doing at home?
All the time. We're talking, we sort of have this running joke, we tell the kids, well, when you go out in public, just make sure you don't lick anything or anybody. Just don't lick anything. Right?
That's a good rule.
It's a good rule. It's a good rule.
It's really a good rule forever, for life. Yeah, don't lick anybody.
Yeah, don't lick anybody. And it adds a little bit of levity to the situation, because in my house, we laugh a lot. That's what we do. But it also helps to kind of reduce their stress about it. But we talk on the daily. But they also, even during this time, have gotten together with groups of friends that they feel comfortable with, masked, and they have been hanging out a little bit more to kind of prep them for going back into school. Now, it's for my son's friends, they're all vaccinated. That was their choice. Everybody got vaccinated. My daughter's friends are still in the category of being too young right now. But the ones who are turning 12 are making their decisions, so that is helping their stress for my kids personally, helping their stress a little bit. But yeah, we talk about it on the daily, just what it'll mean to go back to school and things to look forward to with school. And just remember, every morning when you leave, don't lick anything or anybody.
I love that rule. I think I'm going to put that in my office as a big sign.
In my virtual waiting room, I'm going to put it up. On saying okay.
Yeah, I love that. It's really important before we move on to tip number 2 on dealing with stress is, make sure you laugh. You talked about that in your little talk a few minutes ago. You said that you laugh a lot in your home, and that is so important. Learning how to laugh, it actually will boost your immune system, but it also allows your hormones to flush your body and your mind. That will help you to look at life in a lighter way, even when you're going through tougher times. So find things to laugh about. Even if we're going through a painful situation in your life, it will actually ease your pain. So laugh, laugh, laugh. I love teaching belly laughing. I've done that a few times. I love teaching that because you can make yourself laugh. And I'm telling you, you can make yourself laugh out of nothing. So when people tell me they don't know how to laugh, that's because they haven't tried. You can literally just say, I'm going to laugh, and you can laugh. And if you laugh with someone else and point at them, it makes it even funnier. So
it is very funny. I love when we do that. Hysterical.
Hysterical. All right.
So one of the other ways to, another tip and trick is definitely our self-care, which for many, many people has just gone by the wayside during this whole situation. In fact, I was listening to a story on the news this morning about how heart disease has increased tremendously because during the pandemic, people are actually working more hours and we're sitting at the desk longer. We're living a very sedentary lifestyle. So self-care now is tremendously important. So with self-care also comes our self-talk. We got to get rid of the criticism that we do to ourselves. We put ourselves down. We have to start treating ourselves with some kindness, learning to love ourselves, saying nicer things about ourselves. Get out there and create some hobbies, do some projects, find time to do something that you've always wanted to do and you never made the time for it before. This year, since the pandemic started, I realized how much vacation I was not taking. And so now I'm committed to 4 weeks out of the year. I'm just doing it.
Good for you.
Yeah, we need it. I need the break. I can't be there for everybody if I can't be there for myself.
Absolutely.
So you can also take care of yourself physically to help your mental health. Like eat real food, whatever that looks like in your world. If it doesn't come out of a package, eat something nutritious. We all, joked about the quarantine weight gain, quarantine.
It was no joke, honey.
It's not a joke. I had to laugh at myself though when the pants didn't anymore.
Exactly.
And then down here in Florida, now we roll into hurricane season, which of course means more crap food in your house. But I digress. You want to avoid smoking and vaping. People think that they do that for relaxation. It does not. It actually increases your blood flow and can actually rev up some anxiety. Drink lots of water, get some exercise, and get some sleep. Those things are key.
It's so funny because we say these things all the time and people are probably, tired of hearing it, but yet people don't do it. So don't tell me that you know it, because you don't know it if you're not doing it.
Right.
Or at least you know it at one level, but at the deeper level, you don't grasp it, how important all of this is to keep your mental well-being intact and keep yourself in a positive momentum. Here's another one. Surround yourself with good people, with happy, positive people. Now, does that mean that people are not going to have a bad day? Absolutely not. We're human. But don't surround yourself with negative people that are constantly putting you down, that are constantly telling you, that you're not right, that you're this or that, and that are critiquing you. That's not a support system. That is just the opposite of a support system.
That's more work.
That is work. It is, it zaps your energy. It just really doesn't give you anything good to look forward to. So if it's a family member or a really good friend, just what I say, you can't get rid of your family, but you can certainly monitor the amount of time you spend. You can limit the time you spend with them so that you're not surrounding yourself with negative people. I use the 80-20 rule. 80% of your time, the people should be positive, and then the 20%, it's what happens in life. So you have to give yourself a little bit of a break, but don't allow yourself to surround yourself with negative people. Look for those positive sunshine people, even if sometimes they annoy you, because sometimes I've heard people say, even about me, oh, you're always happy. You're always, well, that's okay. It's okay for you to be surrounded by happy people. It is contagious. So make sure that you're doing that.
You also want to, this is a great time to give more of yourself, to find a cause that you connect with, that, a group that you really enjoy spending time with, and give back to your community. There are plenty of places feeding families right now. So if that's what, your passion is, there are other places that need help with animal care or elder care. Find some place and give of yourself. It allows you to feel good about yourself, get out of your own head and your own problems for a period of time, and you get to meet new people. So many people I know meet new people by volunteering that they make lifetime friendships with and keep us from feeling so isolated.
Well, I'll put in a shameless plug. If you don't have a place, Suit Stilettos and Lipstick Foundation is looking for volunteers and members all the time.
I was going to plug us.
I jumped to it. I didn't want to miss the opportunity because your membership dollars fund all of our programming, including the RISE program, which is to empower youngsters, youth from 11 to 17 to be resilient leaders. And, we need your help on all of this. We're also doing our toy drive if you're interested in that. We do programming for women to empower women. I mean, there's so much there to be done. So, look us up, sslwomen.org. That's a great opportunity, and you could do virtual. So for the people out there that are not ready to be out face-to-face, do a virtual event, support an organization virtually, and you will feel, like you're living in purpose. It will definitely take away a lot of that loneliness and help you feel like you have a reason to be here. So do that. Quiet your mind. And I love this one because sometimes our brains are going so fast and furious. We are, constantly going, that sometimes when we just take a moment to breathe and meditate and pray and relax, just giving that mental break. We talk about going on vacation, but maybe you can't afford a vacation. I see quieting your mind as a little mini vacation, honestly. I taught my 6-year-old and 4-year-old grandson this past couple of weeks that I was with them in New York. I taught them how to quiet their minds. And so you could do this even with a 4-year-old. This is the cutest thing. I would just say, breathe and go Zen. And my 4-year-old walks around going to his brother, his 6-year-old, when he was too active, Micah, Zen.
That's awesome. So if a 4-year-old can do it, no excuses.
No excuses. Just remember to be Zen and do whatever it takes to get there.
Absolutely. I know that during this time too, a lot of people, really put some pressure on themselves to accomplish new goals. Like people were saying, oh, I'm going to learn a new language or an instrument, and
write a book.
Those things are, write a book. There you go. all of these things are great. And if you can do some of them, do some of them, but make sure when you're doing this that you're setting realistic goals, because you don't want to overwhelm yourself now with one more to do. I mean, at the end of the day, I'm done with to-dos. I want to be to done. I don't know about you and how everybody else feels, but then to say to myself, oh no, now I got to go commit to 2 hours of piano. That's not a realistic goal. It's just not going to happen. So make sure that you're setting those and you're writing down the steps and what you want to do to accomplish things. And when you accomplish a step, praise yourself like you've met the goal. That's what's going to motivate you to go on to the next step. Not saying, oh God, I have 9 steps left. That just drowns you in anxiety.
Yeah, it makes you overwhelmed. And here's one for everyone. Shake up your routine. Do something fun. Do something out of the ordinary. Even if you're quarantining, still isolating, whatever, do a picnic lunch on your living room floor, with your husband or your loved one, with your kids, do something fun. Take a road trip. You don't have to be next to anybody. Just do something different just to change it up. I had a patient the other day who has been in isolation all this time and really depressed. She finally got to go out to a restaurant outside by the water, and she came back a new person. She said, oh my gosh, I feel like I'm alive. I feel like I can breathe again. So just change it up a little bit.
And I know that this next one is a no-brainer, but it's not a no-brainer because I have had many patients call me with a sudden increase in both the use of alcohol and other drugs. You might momentarily numb what's happening and numb your anxiety, but you're also, increasing depression on the other side of this. You increase anxiety. You might be harming besides your body and your brain, of course, harming relationships around you. And, at some point, you're getting back out into the world. And I don't think that, many job opportunities allow for the 9 a.m. cocktail. Just gonna throw it out there. I don't really think that that's a thing.
Not anymore. It used to be, guys, but not anymore.
Yeah, not anymore. I mean, I can't imagine, coming into work and having a mimosa and seeing some clients. Like, it's just not going to work.
No, it doesn't work.
Let's avoid that.
Yeah, absolutely. Let's avoid that. But let's say all the tips that we just gave you, none of them are helping. None of them are working. Then that means you need to see someone professionally. Hello. It's okay not to be okay. It's okay to ask for help. Make sure that you go and find yourself a therapist. Going to a therapist is not a sign of weakness. I think it's a sign of strength, honestly. It's a sign of strength because you're saying, I see where I need help. People that ask for help, I think, are stronger because they can see the reality of life. And it's okay to say right now, for this moment, I need help. And that's what Yvonne and I do every single day. So don't be afraid. Let's eliminate the stigma of mental health, mental illness, and let's move on with our lives the best way that we can, because we all can do this. That's what the lipstick attitude is all about.
And honestly, it doesn't get any easier than it is right now. Most therapists are only doing virtual sessions.
Right. So you can do this from wherever you're at.
Yep. I do a lot of car therapy.
A lot of
People
car
are sitting
therapy.
in their car on their lunch.
Yeah. Although I have put my foot down and said, do not chew while you're talking to me.
Because it's gross.
Yeah, because it's gross.
I don't have an issue with it aside from the fact that it's gross.
Yeah. But it's really just go ahead and find some help. Yvonne, do you want to give a way for people to text their donations to support this program?
Absolutely. So if you like what you heard today and want to support this podcast and our future programs, please text SSL Women to 44321. So that's SSL Women to 44321.
And all donations are welcome. We need your support to keep this program going. and to keep all of our programs going. So please help. $5, $10, $100, $1,000, whatever you can, whatever is your best gift, please donate. All right, let's do this, ladies. Let's whip out our lipstick and let's put on our lipstick attitude. Lipstick is our war paint. It's what we put on to go out there and face the world. It's what we do to keep our mental wellness intact. It is what gives us resilience and strength and courage. So put on your lipstick attitude no matter what, ladies, no matter what. We are not just survivors, we are thrivers. And together we can get through anything. So let's do it. We hope to see you soon. Please share this program with someone. You never know who needs this message. So share, 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 listen to it as often as you like. And there are a lot of other awesome programs with awesome guests on our website or on your favorite podcast medium. So let's just keep connecting and follow us on Instagram. Follow me on Instagram. I'm on there finally. Follow Yvonne and follow Suits, Stilettos, and Lipstick Foundation. We love you guys. Yvonne, it was a lot of fun to be with you today.
It is a lot of fun to be with you. I miss my bestie.
I know, I miss you too. We got to get together soon.
Yes.
This virtual thing has got to stop.
Over it. Over the Zoom.
Over the Zoom. All right, guys and ladies, have a wonderful one. We love you guys. We'll see you soon.
Bye.
Bye.